So, today I want to talk about COVID, the Delta variant, and the fact that we're still in a pandemic and very few people seem to care. Now, honestly, I've been struggling to get this video out. Every time I try to put my thoughts on paper, whether it be to try to write some notes or to just write some bullet points for myself to record, I have gotten frustrated and I've gotten angry. With every number that I've written, with every statistics that I've recorded, with everything I tried to put together, I just got really angry and really, really frustrated. And that's because of the needless amount of death and illness that keeps occurring, and seemingly with very few people caring that it's happening. As long as it's happening to other people, it seems to be irrelevant. It'll always be the next person over that gets COVID. It'll always be the next person over that gets the long term conditions. It'll always be the next person over that gets affected. It'll be somebody else's kid that gets affected. But never me, never my family. And then when it comes, people will regret it. And if they don't, then it's usually because of political reasons. And so, for all of that, I have been frustrated. So, consider this me venting it all out as best I can. If that's not something you want to hear, then feel free to ignore it like everyone else seems to be. So, with that said, I do need to point out that it really does feel like people have just given up. And they've accepted that COVID deaths are part of the new normal. And in the United States, especially as the Delta variant has been spreading more and more, especially this past month, we've started seeing absurd levels of infection rates reemerging. As a matter of fact, we have data from the CDC and their COVID tracker that shows that 93% of the country, this was as high as 95% a few days ago when I really started working on this video. 95% of the country was at a high transmission rate. A little bit of this has dropped off as of late, but not a significant amount. And it's really not looking good. And that brings us to some of the statistics that have been happening when it comes to this Delta variant of COVID, which has increased the death rate substantially. And it's been really bizarre because the COVID case rate has only increased less than 1% over the previous 2 weeks, even though the rate of infection has increased and hospitalizations have increased 4% in the same time frame. Meanwhile, the 7-day rolling average of deaths rose 29%. That means that we've had over 1,500 deaths a day for the first time since March. And while those are below the peak levels that we've experienced during this entire pandemic, the daily death totals have more than quintupled since the start of August, meaning in a little bit more than a month's time, we've had 5 times increase in the daily death tolls. And 1,500 deaths a day is not insignificant, and we need to stop considering that normal. And that's the thing, like, so many people seem to be like, oh, this isn't going to be something that affects people, or I'm not going to be the one affected. But 1,500 deaths a day, that's going to touch somebody. If not you directly, then someone in your life that you know. Eventually, that's going to reach people. And that's a substantial amount of people that are losing their lives and that don't need to. And now, on the average, we've had also 152,000 Americans test positive for COVID-19 each day nationwide over the past 2 weeks. And while that has gone down from $160,000, a lot of the Labor Day statistics were not really taken into account. A lot of people gathered on Labor Day. And so that's going to have an increased amount of the spreading of COVID over this next week coming up. Now, in addition to all of this, we have to take into account that there are ICU beds running out in a lot of states. Idaho has begun rationing healthcare with the COVID surges. West Virginia is reporting record high ICU and ventilator cases, and Wisconsin hospitals said that their ICU beds are in short supply. In the meantime, kids are now making up over a quarter of the new weekly COVID-19 cases nationwide, especially as they're heading back to school. And that's something to consider as we move forward. In all, there were 251,781 child COVID-19 cases reported between August 26th and September 2nd, per AAP's data. In that time, there was a 10% increase in the cumulative number of pediatric COVID cases since the beginning of the pandemic. And the Delta variant seems to be affecting kids in much higher numbers than the previous variants did. And it's also causing the offshoot diseases that have been spawning from all of that as well. And when we look a little bit more into the cases of Oregon and Idaho, with them running out of ICU beds, and these COVID cases that are increasing, we're seeing the hospitalization rates with over 1,000 hospitalized in the Oregon hospitals. Um, and we're seeing in Idaho well over 400 people in the ICUs. These numbers just keep going up, and it just, what are you supposed to do when Oregon has a 7-day average of hospitalizations hit 1,200 people and they don't have enough beds to hold people? And as a matter of fact, Idaho is predicting that with the schools opening, that their risk is going to cause the hospitals to start buckling again, which was the entire point of lockdowns at the beginning of the pandemic, to make sure that hospitals didn't buckle. More than anything else, it was to make sure that if people got infected, that it happened over a dispersed amount of time, so that hospitals wouldn't run out of the ability to care for people, especially until the vaccines came out. Well, we're still sitting at situations where in some states, 40 to 50% of the population, sometimes even less, have been fully vaccinated. And, we're just in a situation where people aren't really taking this seriously. And those that are politically against the vaccines are continuing to ignore things, while there are some people who are immunocompromised and actually can't get the vaccine because it won't really do anything for them. And they're relying on their neighbors and people around them to actually get vaccinated to care for them. There's also people who are afraid to get the vaccine because of the country's history. And those people I don't really blame at all for their fear. But it needs to be handled with communication. It needs to be handled very delicately to try to convince people to try to get the vaccines. But the people who are doing it because of political reasons that are completely outside of anything except, honestly, their fear of the government cracking down on people need to really start getting themselves together, and this needs to change. In Idaho, they were saying that 2 to 3% of the children in one district were wearing masks. Meanwhile, on the third day of school, the hospital tallied 109 COVID-19 patients, including 37 requiring critical care, when they had up to 200 beds the day before. And according to this, we're at risk of getting more patients, says Dr. Robert Scoggins, the health chief of staff at this facility. During a news conference on Wednesday afternoon, there's no mitigation in the place in our school systems at this point, and I'm concerned about what's going to happen and how that will affect the care of COVID patients and non-COVID patients. And that's the thing, it's not just COVID patients that we have to deal with. A lot of people still need ICU beds for things outside of COVID. If you have a heart condition, if you have any sort of trauma that happens, you might need access to an ICU bed, and specifically one that is able to get certain equipment. And if that equipment is being used to deal with somebody who has COVID, it is not available to somebody else. So more people could die outside of the COVID patients because all of the beds are taken up. And when it comes to children, schools are opening across the country. And I really feel like I need to address this. As you have schools opening, it's becoming that much more apparent that this Delta variant is spreading to children a lot quicker and a lot more easily than a lot of the other variants. And do I see the same parents who are saying, well, the previous variants didn't seem to affect kids, so they don't need to wear masks, they don't need to be vaccinated? Am I seeing those same parents come out and support the science? No, because it was never about science in the first place. What it has been about is being anti-vax and about not wanting their children to get vaccinated for political reasons, really, that are tied to really foolish positions at this point in time. The Delta variant is spreading a lot more quickly in schools. It's, a lot of schools are still following this 3-foot rule instead of the 6-foot rule for social distancing to try to cram more kids into classrooms. And you still have school districts that are stopping ventilator tests, or ventilation tests rather, like the Chicago public school system, which has completely removed that. In fact, there was an issue in the Chicago school system with the school union back then, complaining that only 91% of the vents were functional when they were being tested, and they needed to increase the amount of testing to make sure that the vents were actually working in buildings. Because if you have children in school buildings with no vents and no windows, because a lot of them were built in old warehouses, then how are you supposed to keep the kids safe when they're boxed in a room, even with masks? How can you keep them safe when they're boxed in a room with a variant of the virus that spreads a lot quicker than the older variants and is seemingly causing increased levels of transmission, infection, and death? That is a problem. And again, we're not doing anything about it. We're not locking down anytime soon. Meanwhile, when we look at these ICU bed situations, we have this data in front of us where a lot of states have over 90% of their ICU beds being utilized already. Idaho, Texas, Georgia, Florida, I see there, and Alabama's at 102.5% of ICU beds. I don't know what they're doing to try to keep people in check. Now, a lot of the areas where vaccination has been high, the vaccination rates have been high, seem to be doing relatively okay compared to other locations. The Northeast and the Pacific Coast in particular. That said, even those regions are still seeing over 60% to 70% ICU beds being used. And that means that within a matter of weeks, we could see all of these hospitals buckle as more and more school districts start to open and this virus spreads to more and more kids. And I don't even know what to say about that and the fact that we're not even considering lockdowns at this point. Like, it really does feel like people have just given up on all this. There's no plan for lockdowns. What people need right now, more than anything else, is a paid lockdown where they can stay in their homes and be taken care of. Countries that have shut down have lowered their numbers extensively. I believe New Zealand already started shutting down and has already lowered their rates that skyrocketed with the Delta variant. And a lot of other countries need to be following suit, especially the United States, who, again, doesn't seem to care that there's 1,500 people dying a day as more and more kids are sent back to schools with improper amounts of social distancing, without masks. In fact, you have entire states that have mandated that children don't have to wear masks and, in fact, can't be mandated to do so because that's against the law. Because if a child wants to be able to do it, or a school district feels that it's safer for the other kids, they're not allowed to. That's against the law now. And it's places like Florida and Texas and Arizona that are putting this out. And if you see the concentration of a lot of the places that are running out of ICU beds, it's all in the southeastern parts of the United States and in the southern parts of the United States as a whole. And I'm just frustrated and I'm angry that capitalism, the need to open the economy, this cult of death that seems to be happening with a lot of the red states, a lack of planning, and everything else that I've mentioned previously in these videos that I've talked about COVID has led us to the point where we're unable to properly respond to any of these waves, where people are claiming that they're just so tired of everything that they don't even care, and that this is becoming the new normal, and that realistically what's going to end up happening is the boosters and the vaccines are going to have to be administered probably annually, like the flu shot. And we have to hope that this new Mu variant that's coming out and is starting to spread doesn't end up being the thing that subverts the vaccine and just goes past everything else. And then we'll be back to square one, except we won't take lockdown seriously and we'll be content with everyone dying. And that just seems to be the new normal that we're fine with as schools reopen and people are starting to go back to offices, and ventilation isn't necessarily an important thing in a lot of school districts, like I said with Chicago. So with that said, if you like this video, please give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my Discord in the description down below. My name is Anarchist Tara. I thank you for giving me the space to vent it all out. Let me know what you think of what I had to say, and I hope you enjoyed watching.